If you're not sure if you're in the right place, this is the Naloxone training or Narcan. When and how to use it. Guest training by the Rayce Rudeen Foundation. So, really excited about this one. We're gonna bring in some other people, some experts in some stuff that we are not experts in. So, excited to get this started. So the way today's gonna work is a little bit different than normal. So, we did some pre-taping that we're gonna play, pre-interview stuff on the very practical how to use Narcan. And then we're going to do a Q&A with uh, the pharmacist who taught that. And then after that, we're going to switch over and hear from a former DEA agent with kind of some background on all this. And then we'll do a separate Q&A with her. So you're going to get like one part training, Q&A, another part training, Q&A. So that's going to be that. And quick word from my sponsor before we get dived into. And that's this. Hey, by the way, we're the sponsor. If you don't already have our training, we do de-escalation training, especially around cognitively impaired populations, homelessness, mental health issues, trauma, substance use, PTSD, you name it. We got basic series, we got our crisis series on kind of some more spicy stuff, some special populations, particularly focused on, again, mental illness and substance use, bunch of special situations, and then finally a few trainings designed specifically for managers. All right. So if you aren't, again, if your organization is not a member, you want to see about becoming a member, just go to homelesstraining.com/free-trial, and you can get a free 2-week trial there. See if you like it. All right. Now that that's done, let's go ahead and dive into learning more about how to use Narcan.
Hi, my name is Lacey, and I am with the Rayce Rudeen Foundation. The Rayce Rudeen Foundation is located in Spokane, Washington. And this foundation was started after the Rudeen family lost Rayce to a fentanyl overdose. In 2016, fentanyl wasn't really being seen in our area, and the family really had not heard of it. After losing Rayce, within 3 months, they started this foundation to try to help other families that are struggling with family members who are in active addiction. And then also they wanted to educate people on the dangers of fentanyl. In 2021, the foundation connected with multiple leaders in the Spokane community and started the SAFE program, which is out to educate community members on the dangers of fentanyl. It was then that I became connected with the foundation. As at that time, I was the supervisor of the Drug Enforcement Administration here locally. So one thing that the foundation has done is we have partnered with different people in our community to raise awareness of opioids and to also teach people about how to properly identify and use Narcan. So I'm here today with my co-presenter, Nicole, who's going to come on here in a little bit and is going to teach everyone how to identify a opioid overdose and how to properly administer Narcan. Okay, that's all for me. Now it's Nicole that's going to go.
All right. Well, welcome. My name is Nicole Rodin. I am a pharmacist by training. I teach at WSU, Washington State University, in their College of Pharmacy and Pharmaceutical Sciences. I do specialize in substance use disorders, including opioid use disorder. And I do a lot of education around opioids, prevention strategies, overdose prevention strategies, including naloxone use, storage, and identification of an overdose situation. And let's see, I've been doing these different naloxone presentations for the past several years now, and I've been partnering with the Rayce Rudeen Foundation since about 2017 or 2018 to partner in getting a lot of these presentations out into different diverse community settings. We are looking at Narcan to reverse opioid overdose, and so this works on all different kinds of opioids, including some of our more common prescription opioids. So if somebody is overdosing on a medication like oxycodone, codeine, methadone, or prescription fentanyl, this is going to be a reversal agent for all of these different prescription opioids. it is also going to be a reversal for our illicit opioids, like heroin or the illicitly manufactured fentanyl. What naloxone does is it goes into the body and it has a higher affinity than most opioids, and it's going to kick those molecules off the receptors. And so by replacing the opioid molecules and sitting on the receptors as naloxone, it's going to stop all of the function that's happening on that receptor. So it's stopping all of the bad things. Hopefully we start breathing again, we are able to regain consciousness, but also it's going to stop the good things, which is why we see people go into withdrawal as soon as somebody uses naloxone. So is naloxone safe? This is probably the number one question I get asked by anybody. And the answer is yes. Naloxone or Narcan is a very, very safe medication. It actually has one of the highest safety profiles of any medications we have on the market. So with this medication, it has a very specific job that it does. And with that job, it is attaching to those opioid receptors. If there is no opioid on board, we are going to see no effect. So if we misdiagnose this as something that is a different form of emergency, let's say they're having an asthma attack or a hypoglycemic attack that can look really similar, it's not going to make that situation any worse. It's not going to harm that person any further. It is also safe for any age group, and it's really easy dosing. So from toddlers to seniors, everyone's going to get the same dose. So my 3-year-old is going to get the same dose as a linebacker on a football team, right? And that's what makes it so easy to use and what makes us feel so confident in using it. So when you are coming onto a scene that you think might be an emergency situation, the first thing you want to do, just like with CPR, is assess the scene. So you're trying to identify some of those signs and symptoms of an opioid overdose. So 3 hallmark signs that we're really looking for is going to be if that person is responsive or not, and if they are breathing or not, and if that oxygen is actually getting to their body systems. So if we are checking for, in step 1, our overdose signs and symptoms, we're going to try and get their attention. So you're yelling their name, you're really trying to wake them up from that unconscious state, and we're going to do this in 2 ways. 1, we're going to use our knuckles to do something called a sternal rub, and so you're going to get the bony part of your knuckles here, and you're going to rub it along the sternum. So the sternum is that chest bone up along the upper part of the chest that kind of protects the heart. So when you're doing that, you're getting the bony part, and your goal is to hurt them. You want to wake them up. You want them to come back into consciousness. So it does need to be enough pressure that you feel that they're going to kind of hurt, right? And so you're going to push it down into their sternum, and you're just going to drag your knuckles all the way down the sternum. If for whatever reason you don't feel comfortable doing that, you can do an alternative way, which is using your finger knuckle, so this top bony finger knuckle, and dragging it on the upper part of the lip. So this part between the nose and the upper lip is going to be the top of the teeth, and so the same applies here. You want to hurt them enough to get their attention. So you're going to drag that finger knuckle all the way across the top with enough force that they're going to respond to it. And if somebody is not responding to it, they're non-responsive, which is a good indication that this is an emergency situation. Other things you can check is if they're breathing. So the rise and fall of their chest, if you're not able to see that, they're probably not breathing or feeling the exhale of air from their nose or mouth. If you want to check if they're actually getting oxygen to these different parts of their bodies, you're going to check the fingernails. So on the top of the fingernails, despite skin tone or color, it's all going to be the same fleshy pink color. If they are not oxygenated, that's going to start to turn blue, and so it's a very noticeable blue on the fingernails. If for whatever reason you can't see the tops of their fingernails, whether they're painted, they have acrylic nails, or something else, you can check the inside of the lip. So here, again, despite skin tone or color, it all should be a fleshy pink color. If it can have it can have some veins in there that look a little bit purple, but when it starts looking blue, and I mean blue, that means it's not getting oxygen to these little parts of the body, which means we're not getting oxygen to our brain. When somebody might be asleep, I always bring a water bottle with me, and I come up to them and I very gently kind of try to wake them up, and I'll give them maybe a slight shoulder shake, and if they wake up right away, then I'll say, hey, I just want to make sure you're feeling okay. I'll reference the weather or something like that outside, and if they need a water bottle, and I'll have something to offer, right? And sometimes that sets people at ease a little bit more than forcefully trying to get their attention. But if they aren't responding to a gentle shoulder shake or trying to get their attention verbally, then I'd move to the next step of trying to forcefully wake them up. And so for the next step, you want to call 911. So when they're not responding, it is an emergency situation. It might not be an opioid overdose, but it is definitely an emergency. So we want to call 911 even before we are administering this Narcan. When you do call 911, you want to keep two things in mind. One, you want to very clearly verbalize that somebody is not breathing. This ensures that they're coming with the right amount of urgency, but also that they're coming with the right tools as well. Second thing you want to keep in mind is very clearly stating where you are. And so this does mean knowing your address, having it on hand. This is one of the first things to go when you're in an emergency situation. Some of that knowledge, you just kind of flies out the window. So I do recommend writing it on your box of Narcan so that you have it there ready. If you're in a system that has a really big campus, I'm on a college university campus for my primary job, it is good to know kind of the layout of where some of those buildings are and where you might be most frequently. So if there is a gym or a hallmark feature that identifies location on your campus, referencing where you are in relation to that can really help EMS get to you a lot quicker as opposed to just a very general address. So keeping it on the box is super helpful, and keeping that Narcan on you, especially if you have a big area that you're encompassing or covering. You never know when emergency is going to happen, so having it readily available is going to be super important. All right, so after we have identified signs of overdose, we have called 911, our third step is to actually administer that Narcan. And so when you get a Naloxone box, it is going to look similar to this. This is an expired Naloxone box I use for training, but it looks the same. If you do get a generic version, it's going to look very similar. And on the inside, you're going to have two of these canisters in plastic packaging. So in our two canisters of plastic packaging, you're going to take one out, and the reason they're encompassed in plastic is because they don't want you pushing that plunger until you're ready. Once you push it, it's done, and that's the medication dose. And so we want to keep it here protected until we're absolutely ready to use it. So if you've identified this as an emergency situation, you're ready to use it, you take it out of your box, you're going to just peel that foil back. It's pretty easy to do, and you're going to take this out of its packaging. So this is going to be the top part of that canister, and this is the bottom, this is the plunger, and you're going to be putting this into somebody's nose. So I'll turn to the side so you can see. Your two fingers rest on top here with your thumb at the bottom of that plunger. Again, don't push it until you're ready. But when you are putting this in someone's nose, it might be easier to put it off to the side, insert it into the nose, and this is as far as it goes on me. And so you don't have to put the entire plunger in someone's nose if it doesn't fit. As soon as you feel resistance, that's good enough. It's not absorbing through the brain or the airways. It's actually absorbing through that pink moist layer inside the nose. So it doesn't need to go far. So you place it in there and you depress and you're done. That is all that it is to actually administer naloxone. And so when we do have our naloxone doses, this is going to be brand name. It is a nice airy liquid, and you do want to be quick to push the plunger. It's not a difficult plunger to push, but when you do, it's just going to be that quick spurt of medication that is very aerosolized in the air, and so you want to make sure that that's absorbing as much as it can inside the nose. Now, I get asked questions all the time. Do people need to be breathing in order for this to be effective? No. Again, we don't need this medication to go in the lungs. It's absorbing straight through the nose. If they do have some sort of blockage in the nose, big blockage, you want to go for the other nostril. If they do have a small piercing, it might block you from going as far as you need to, but you don't necessarily have to avoid that as long as you can get that canister in. With naloxone, it is only going to last in the body for 30 to 90 minutes, so you might need to repeat your doses. If you do need to repeat, you can give another dose every 2 to 3 minutes. How do you know if someone needs multiple doses? They just don't respond, so they'll continue to look lifeless and clammy, and they'll still continue to be unconscious with no signs of returning to breathing. So earlier this year, I was helping reverse an overdose, and I think it took 3 or 4 doses in order to see any signs of breathing again. And those 2 minutes in between doses can feel a lot longer than 2 minutes. And so trying to get it spaced out as best you can. But by that 4th dose, they kind of made this one big gasping breath. And so typically you'll see a very obvious sign that someone has started breathing again, even if it's really slow breathing. So that's your sign it's working. Opioids are going to last longer in the body than our naloxone does. Even fentanyl, which gets out of the body pretty quick, is going to be in there for an average of about 2 hours. So if they overdose or reversed with naloxone, we encourage them to still have emergency services in case they need those follow-up services. And so the 4th step that we are going to be doing for this person once we have gotten the naloxone in their body is going to support their breathing. So we want to make sure we are putting them in the best position to support that breathing. So we are going to be putting them in the recovery position. You roll them on their side, and you're going to have their outside arm tucked underneath their head to prop them up in case they do vomit. Vomiting is a very common withdrawal symptom, and we don't want them to choke or breathe in any of that vomit, leading to aspiration. So when they are on their side, outside arm is propping up the head. It does also help when they come to in a very foreign or jarring situation. It can help calm somebody down before feeling those intense feelings of pain and withdrawal after being reversed from an opioid overdose. And that 5th step in this opioid reversal process is going to just be monitoring. So you want to stay with that person, you want to be close by, and you want to let the EMS know what has happened. So how many doses of naloxone have you given? When approximately did you give them? About how far apart? And have you seen any change since you gave that naloxone? If no change is happening and you've given several doses, there's a high probability that something else is going on, but this gives them a lot of good info in order to appropriately respond to that. Probably the number one most common myth I hear about naloxone is that it perpetuates drug use, and they've actually done a lot of studies on this. It doesn't perpetuate drug use. Drug use is the same in laws or in states that have laws that are really restrictive to harm reduction services like naloxone, as it is in states that are a lot more lax when it comes to harm reduction services. The next common myth that I hear people say is that they're concerned for their safety, which everyone should be concerned for your safety, always assess the scene, but people aren't as combative when they do get reversed with naloxone as it's portrayed in movies or commercials or things like that. Now, there are certain situations where it's a little riskier. They're finding that the longer somebody has been without oxygen, the more likely they are to be combative. And so if you know somebody has been down for a long time, not breathing, the chances might be a little higher that they're combative. Or if they're in a really jarring scenario, I think police are a little bit more at risk of this because the police are a jarring presence to someone using substances. And the chaos of the lights and the reaction can kind of anticipate a little bit more extreme reaction when someone wakes up. So there are some do's and don'ts we have on here on how to respond to an overdose. And we put these in here because we hear this from patients from time to time. So things we are going to do are follow those 5 steps, right? We're going to attend to that person's breathing. We're going to help support them in the recovery position or with chest compressions. We're going to give them naloxone, and we're going to stay with them, keep them warm, keep them safe, whatever. What we don't want to do is slap or forcefully try to stimulate that person past the sternal rub or the upper lip rub, right? We're not trying to shake them. We're not trying to slap them, especially after we administer naloxone. This can not only hurt somebody, it can also make them more combative once they do come to. And so we want to avoid that combative nature as much as we can to keep ourselves safe. We also don't want to put that person in a really cold environment. So we don't want to put them in a cold bath, cold shower. You don't want to throw them in the snow or pack ice on their body because this has the potential to put them into shock. And so that just worsens the situation. Sometimes like a cold washcloth or something can help stimulate that person and wake them up. We don't want to submerge them in any way, shape, or form in that cold environment to avoid shock or drowning. We also don't want to inject the person with anything. I've heard this a couple times from people in naloxone trainings. We don't want to inject them with other stimulants, salt water, milk, vitamin B, anything else. The only safe and appropriate treatment is naloxone. And we don't want to try and make that person vomit any drugs that they have been swallowed. this isn't effective. It can make them choke on their vomit or inhale their vomit, which can cause more harm than any good that we're doing. But also, a lot of patients aren't swallowing their drugs, right? It's typically either smoked or injected, in which the contents of our stomach do not determine the outcome of that medication. So it's not really going to help anything either. I don't think there's any true mistake you can make with the intranasal naloxone. I think it's just how you respond to emergency situations is probably the most variable aspect. So practicing either verbally in your head or with a partner, it's really hard to do something if you've only watched or read it once. So at least being familiar with some of those steps is very, very helpful in responding in the moment. Also, having other people on your team that know what to do. So if you forget one minor aspect of it, that other person on your team can help jump in, and teamwork does make the dream work in that sense. The best thing to identify is your needs and your training needs and how comfortable your staff feel. Because if they don't feel comfortable doing it, that might be an opportunity for education. And then once you feel comfortable and you know what to expect and what to do, then you can develop some of those policies and procedures surrounding it. My advice is to keep them short and simple. This doesn't have to be a long, lengthy process as long as you know what to do in that instance and everyone's clear on it. Also, overtrain. Overtraining on it is going to be the biggest thing. So at least annual refreshers on how to do this, just like you do with CPR, can be super helpful, especially if you don't ever have to do it, just brushing up on those skills. So what is the typical protocol to addressing an opioid overdose? You want to have proper storage of this. So you want your naloxone to be in a place that is easily accessible, but also meets your area's standards of how medications should be stored. If it's stored at a workplace, that's going to be a little bit different from place to place, but we want it as accessible as possible, just like any other emergency medication, like an EpiPen or glucagon. Keeping it at room temperature is ideal. However, you do want to make sure that it's accessible and on you in most cases so that you can actually use it. And so this goes for checking the expiration dates too. In an emergency situation, an expired or improperly stored naloxone is better than no naloxone, so still use it if you have it. Once you do use it, though, you want to make sure that you replace that naloxone right away and that you have it on site in case this emergency happens again. You want to document this administration, especially if it's in a workplace environment, so that you can maintain those policies and procedures and debrief as needed. You want to make sure you have at least some resources for that person who had overdosed or was poisoned, if you are able to. And then you want to support the staff that administered that Narcan. This can be a jarring experience to someone who's never seen something like this before. And that's a totally valid response to this situation. It truly is an emergency situation that not everyone sees every day. And so earlier this summer, we had an overdose situation at my clinic. We reversed it with naloxone, and one of our clinic personnel, who is a younger person, had never seen anything like this before. And they were really jarred at the fact that they saw someone who looked dead, right? And that the whole process was so emergent, and once the reversal was over, the patient was safe and they survived and they went with EMS. But our staff who helped administer the naloxone or the Narcan needed support after that, right? They needed to talk to a professional to kind of decompress and digest what had just happened. So knowing that that is a possibility is important. And then after some time has passed, you want to have a debrief about what happened. Some key things you want to keep involved in this debrief is including everyone that was there, not just the person that actually administered the naloxone. You want to keep that person involved, whoever called 911, whoever witnessed this, all of those people that were there, bring them into this debrief. You want to be timely but sensitive, so make sure those people that need the extra support get the support they need before reliving this and debriefing it in this situation. But you don't want to wait too long that nobody forgets the details or nobody remembers the details about what happened. And so usually within a week is going to be an ideal time to debrief on what happened. You want to create a safe environment. So what that means is you want people to feel comfortable sharing what actually happened without fear of getting in trouble, fear of being ridiculed, or fear of being chastised in this group setting. Especially in emergency situations, things don't always go as planned. And the point of this debrief is to make sure we keep getting better every time. So if we notice something didn't go as planned or something was a little off, we want to update those policies and procedures as needed to accurately reflect how we need to use them. We also want to provide education as needed. So if we come into the situation where, let's say someone on our team didn't know where the naloxone was, let's remind people on a regular basis, where is this naloxone? They forgot how to use it. Maybe we should bring in some training occasionally so that they remember how to use and follow the procedure in an emergency situation.
We're going to transition now to the live portion. So that was the pre-recorded. Now we're going to talk to Nicole primarily with your questions. Nicole, anything you want to say before we dive into the questions?
I don't think so. Just thanks for having us. I'm obviously passionate about the topic, so let's dive into the questions.
Excellent. I got a pretty good idea what the biggest question is going to be because a lot of people are trying to put that in the chat box earlier. Okay. What if you make a mistake and the person isn't overdosing, but you give them Narcan anyways?
Yeah, naloxone is very safe and it has one specific job. So if something else is happening and you haven't identified it, it's not going to make that situation any worse. So if it is a seizure, a diabetic, hypoglycemic attack, an asthma attack, it won't help, but it won't make it worse either. And so that is great information to give EMS when you do call that I gave 2, 3 naloxone doses. No change has been seen in this person. And so it just didn't help, right?
Cool. Do you need more? Try that again. Do you need more naloxone to reverse an overdose for more potent substances like fentanyl?
Yes, so the more potent the substance, specifically our synthetic opioids, you are probably going to need more than one dose of naloxone. Each box of naloxone comes with two. Sometimes you will need more than those 2 doses. So they are pretty potent, pretty strong now in the drug supply.
Yeah, I was talking to a paramedic recently, and he was saying that for some of the really, really strong stuff that's new, even the paramedics don't necessarily carry enough Narcan because it's that strong. So, eeks. Okay, next one. Really good question that I hadn't thought of, but this is good. Okay, so I got my Narcan, I got my CPR training, I've got my AED machine. How does all this fit together?
Yeah, they all have similar steps. And so just like with CPR, with naloxone, you're going to assess your scene, you're going to kind of go through this. With AED, it depends on what the scene looks like. If you feel like this is going to be a cardiac event, and if there are other clues around, like the person was clutching their chest or there were some signs that it was heart related, you could attach the AED machine to see if it's needed. Um, Oftentimes, a good first step is going to be naloxone if it's a high risk area, because it does work so quickly and it does give you answers a little bit faster. If you want to integrate the full CPR procedure, especially with the AED machine, it would be on that step where you're monitoring their response and supporting their breathing that you can integrate that CPR and AED machine after naloxone has been administered.
Gotcha. So shoot up the naloxone first, then we'll see if we need the CPR and the AED.
Yeah.
Cool. How can you tell if a person's overdosing or having a diabetic event or a seizure?
Especially if you haven't been trained in medicine, you might not, and that's okay. So this is another area just to highlight how safe naloxone is. Sometimes we have clues as to what's going on. So somebody's wearing a bracelet that says they are a diabetic, or they have a bracelet that says they do have seizure disorder. But sometimes you don't know that. In my job, I don't often know the details of people's personal medical history when I see them out and about. And so you kind of have to err on the side of looking at the signs and symptoms and following the 5 steps to an overdose. And if the naloxone doesn't help, you can rule out overdose pretty quickly, but it won't make it worse. And so you have EMS on the way, and so you're still doing your due diligence to get that person as much help as they need as quickly as possible.
Yeah, I think that's the idea. You've already called 911. Like they're already on their way. This is just something you're trying to do while you're waiting. Here's a fun question. How expired is too expired?
It depends on what you have on hand. Again, naloxone is better. Expired naloxone is better than no naloxone. They've done some small studies on the vials of naloxone that you get in the hospital, and they showed that it was more than 95% effective after 20 years past the expiration date. Now, that was for the vials. It's a different preparation than the intranasal ones, but it shows that the molecule is pretty stable. And so if it's expired and it's been a couple years, it's still better than not administering anything. They have shown no adverse reactions to any of the kind of breakdown products once it does start breaking down. So some is better than none.
Okay, so try to keep it new, but if you can't, use what you got.
Yeah.
Can you talk through assessing the situation upon arrival? How do we know to not start CPR?
That is personal preference. And so typically, if you're really unfamiliar with the area, unfamiliar with the person, you have concerns about personal safety, trust your gut. You can always put them in the recovery position, and that will protect their breathing and that will help support their breathing. If you do feel comfortable giving CPR, you can. Hands only or mouth to mouth CPR with the rescue breaths can be administered, but it is up to your personal preference when you are assessing that scene.
Next question, I'm not sure you can answer, but let's give it a try. What legal boundaries should we as employees keep in mind when administering Narcan? And does this differ for public versus private employees?
So legal boundaries are going to be different than your policies and procedures and what repercussions can happen at your workplace. So you should always be familiar with what your permissions are at your place of work because that is going to be different for public versus private employees. Every state is going to have a different Good Samaritan law. And so being familiar with your state's Good Samaritan law is going to be important because that is your legal protections. Some states like Washington have pretty comprehensive Good Samaritan laws where others are a little bit more restrictive. But the essence of a Good Samaritan law is when you work in good faith to help somebody who is in an emergency situation, like an overdose, and you're not asking for anything in return, you're not asking for them to pay you later, that you are protected from legal repercussions in that scenario. So from being sued or anything like that.
Good answer. I'm a lawyer. Good answer. Do we need to tilt the head back when we use it?
You can tilt the head back. It depends on what position they're in initially. So tilting the head back is going to open up that airway a little bit and increase access to the nose. As long as you can get it in there, it is going to be effective, right? So it's just that soft pink part of the nose on the inside. So you don't necessarily need it to angle in any certain way. But if that helps you get it in there, great. You can tilt that head back a little bit.
When you give more than one dose, do you switch? Do you like go back and forth between the nostrils?
You can. Yeah. If there's something that's blocking the other nostril, I wouldn't. But yes, you can go back and forth to help increase your surface area.
All right, here's an interesting one. I watched the National Guard give a dump of couple sugar packets into an unresponsive individual's mouth after administering Narcan. He insisted that it helps with the individual's blood sugar. Have you heard of this? Had any experience with this?
I do not recommend doing that anytime that you are putting something down a semi-conscious or unconscious person's throat, you increase your risk of them choking on it. And so, especially if you are not a trained medical professional, I would just stick to the 5 steps, give them that dose of naloxone, and then allow them to come back. You can see dips in blood sugar if somebody is experiencing withdrawal. That's definitely possible, but that's another reason why we call 911. Those supportive services are much better administered in an emergency room, in an ambulance, or somewhere where they're prepared to handle it, as opposed to me on the side of the road with someone that I don't know.
Can naloxone be effectively stored in a vehicle that experiences extreme heat or cold fluctuations depending on the season?
It can. And so this is just like our first responders, right? So they have them typically in their glove boxes and they use them and they do still work. If they do get too cold and you notice that it is cold to the touch, you can try warming it up by rubbing it in between your palms. That can help if it has kind of crystallized a little bit. And as long as you are not leaving it for prolonged periods of time in those extreme temperatures, it should be pretty good to administer from there on out.
And I have to assume this is also kind of like, not having done that's better than having done it, but having anything is probably better than doing nothing, right?
Yeah, absolutely.
Is Narcan freely available? If so, from where? Basically, I think the person's asking, how do I get my hands on this?
Yeah, it is going to be very state specific. And so different state have different laws on how accessible this is. If you just Google, how do I get naloxone in your state? There are typically resources from your health department that points you in the right direction. In Washington state, you can get it from the health department. They will mail it to you. It is free. And our neighbor in Idaho, they are not allowed to dispense naloxone unless it's to a first responder. So it's really dependent on where you're at, on what those different laws look like. So a quick Google search should point you in the right direction. If not, your local health district is the best first place to go. When in doubt, they are all over the counter in every state. And so if you want to purchase it, it's about $45 at Walgreens, CVS, Walmart, any pharmacy. And you can get those 2 doses over the counter, no prescription, no questions asked.
Oh, I had no idea it was that expensive. Working at a shelter, I've just always had access to tons of it. Holy
Yeah,
cow. Okay.
it does provide a little bit of a barrier when it's that expensive. So not everyone's willing to pay $50 for 2 doses, but um, health districts tend to fill that gap a little bit more.
Yeah. After how many doses do we stop? And side story, at our shelter once they used 8 things. The guy was just like soggy after they were done. When do you stop?
Yeah, you stop when EMS arrives. And so once you get that handoff, you can stop or when you run out. So if you only have 2 doses, you're only given 2 doses, right? I think the highest I've seen was a news article out of Seattle, and 33 was the number of doses that they had given. If it didn't help after probably 20, I might have stopped, but um, just when EMS arrives.
Okay. What if they have no pulse? Will the naloxone get to the receptors if there's no blood circulation?
Yep, as long as it is absorbing through there. So sometimes it is a very faint pulse at that point. It is still better to give that naloxone to try and reverse those opioid molecules off the receptors.
Here's an interesting one. What's the victim feeling when they awaken?
What is that person feeling when they awaken? Probably a lot of physical and mental pain. It does reverse all of the bad things, but the good things too. So withdrawal from opioids hurts. It very much so hurts, right? And people aren't just taking those substances to stop physical pain, but also mental pain. So the fear and the anxiety and kind of the whiplash of that is going to be very apparent when that overdose is reversed. But typically the physical pain tends to take over. So all of those pain receptors are now open in their body. And so they're feeling shaky, muscle tenses, vomiting. There's just such a plethora that goes into withdrawal because our opioid receptors are in every part of our body. So it affects pretty much every system. And so it's very uncomfortable.
My wife actually had Narcan once after she had a surgery, a very substantial abdominal surgery, and they gave her too much opioids afterwards. And to the point where she stopped breathing, and we had to keep like literally like waking her over and over and over again. And after like
Wow.
4 hours of us trying to keep her awake, they're finally like, okay, we're not going to do this anymore. And they threw some Narcan into her IV. And I mean, it was almost like a cartoon. Within seconds, she went from
Yeah.
unconscious to screaming at the top of her lungs. And this was like 6, 7 years ago, and she still reports having PTSD from the it was so jarring to go from, in her case, passed out to no medication after a major surgery. But it was wild to watch just how quickly it worked. Even though, I mean, that was an IV one, but still.
Yeah.
Any risk of allergic reactions to Narcan?
There has not been one single allergy reported to naloxone through the American Association of Allergy and Immunology. And so, while I'm sure anything is possible, that has not been the case thus far.
All right, we're gonna do 2 more questions, and then we're gonna move on to our next part with Lacey. Um, is there ever a reason not to give Narcan to someone who's unresponsive?
If they are checking the boxes to the unresponsive, not really breathing, usually there, and you feel like it might be an overdose, there's no reason not to give it. It will not make any other situation worse.
All right, final question. What if the person's not unconscious yet? Oftentimes, you can watch that nodding off. You can watch that kind of slow slide. Do you wait for them to pass out before you give it to them? Can you give it to them beforehand? How does that work?
You typically wait until they are unresponsive. And so if they are in the nod, if they're kind of folding, they're over medicated for sure. They're definitely high, absolutely. They aren't at that point of overdose yet. And so it's like CPR. You're not going to start CPR on somebody who's still breathing and still conscious. Um, that's also just a very jarring effect, and it could be a situation that you're putting yourself in that might be a little bit unsafe. And so the recommendation is to wait until they meet all of those criteria for unresponsiveness.
Excellent. Thank you. Anything else you want to throw in before we move on to the next part?
It's just really safe. It's pretty easy to do. So if you can save a life, it definitely is worth it.
Excellent. Thank you so much. This was incredibly helpful. I saw a lot of comments in the chat box about people being learning a lot, and I learned a ton, and I already knew a lot. So bravo. Thank you.
Awesome. Thank you, Ryan.
All right.
Appreciate it.
Excellent. All right, Lacey, if you could join us. And if you wouldn't mind, just because I'm super curious, and I'm sure other people are, just give just a little bit of context of what you did with the DEA, because that's just interesting. And
Sure.
then take it on.
Hi. Well, thanks and good afternoon, everyone. I worked for the DEA for 26 years. I was an investigator and then went and became a supervisor. I've worked all over the world, enforcing the drug laws of the United States. And what got me involved with the Rayce Rudeen Foundation was just when I was working with DEA and I saw the impact that fentanyl specifically was having on our communities. It really impacted me, and I was worried about, my family, my kids, the community that I lived in. And I saw the work that the foundation was doing, and that combined with my law enforcement work, I was able to start doing this with Nicole and others at the foundation. I retired from DEA about a year ago, so I have been working with the foundation since then, pretty much full time. It's been great. All right. So Nicole talked a lot about identifying an overdose and what to do if you do identify an overdose with given that Narcan. But the question becomes why, starting in like 2019, did we as a country start seeing so many more overdoses? And the answer to that is fentanyl. What we started seeing, I mean, fentanyl's been around for a very long time, but we really started seeing it hit the streets on the West Coast in like 2018. It hit other parts of the country earlier, but 2018, 2019 is, and then even into 2020, we started seeing a huge number of people overdosing from fentanyl specifically. And that's because fentanyl is extremely potent. So a very, very small amount of fentanyl, up to 2 milligrams, is a potentially lethal dose. So if you think of a few grains of salt or sugar, that's what 2 milligrams is. And that has the potential to kill you. So we saw a lot more fentanyl entering our country and hitting our streets. And with it being so potent and such a small amount being potent, that's why we started seeing that huge increase of overdoses. We also, with the illicitly manufactured fentanyl, not pharmaceutical, not the stuff people are getting from the pharmacy or their doctor, but the stuff that is being seen illicitly on the street, they have unpredictable dosing. You don't know how much is in a specific pill or powder or vial of what you're taking. So if it's not produced in a lab, the dosing is unpredictable, which makes it more dangerous. And then we do find widespread contamination. So there's fentanyl now in every illicit drug. It's found in heroin, meth, coke. It's pretty much found in everything. So again, what happened and what we continue to see happen is people may be using another substance, and they end up overdosing from the fentanyl. So what does it look like? Bear with me, I have a cold. But fentanyl comes in a lot of different forms. It can be liquid, it can be powder, it can be pills. When we started seeing a lot of overdoses, the pills looked like pharmaceutical grade pills. So what you see on your screen with the counterfeit oxys, that's a lot of what we saw on the street. And that people were taking and becoming addicted to quite quickly and then end up overdosing from. But we do see it in other counterfeit pills, in Xanax, in Adderall, and in other things. Um, in about 2020, 2021, we started seeing it and what is referred to on the street as Skittles, but that would be the colored pills. We see it in colored powder that that may look like sidewalk chalk. It could be in like pressed powder, like you would historically we see cocaine or meth in a pressed package. But we also now see that fentanyl is on the street in that same way. And this is again has caused been resulted in more overdoses and also people becoming addicted to opioids who may not have been exposed to opioids earlier or at any point. Um, we see we see cases of kids that get a hold of a substance that they believe looks like a candy and they end up overdosing. Or younger people may start experiencing things a little bit earlier by the way this is marketed. So how's it used? Fentanyl can be snorted, sniffed, smoked. It's a pill. It can pretty much be used so many ways. But what we see a lot of are people that are smoking it. They smoke pills or even the powder, although powder is more than it's injected more frequently. But the you will see in some areas a lot of tinfoil that has black on it. That is kind of indicative of somebody who has been smoking fentanyl. Um, Along with that, we have a lot of people who are worried or they've heard a lot of myths about fentanyl and if they help, that they may be putting themselves in harm. A couple of myths that are out there is that if somebody's smoking fentanyl and you walk into a room, that you could overdose. And that's just not true. There's been no cases, at least confirmed clinical cases, of somebody experiencing an overdose from secondhand smoke. What I will say is, based on the way that fentanyl, illicitly manufactured fentanyl, so the stuff that is on the streets and that a majority of people are using, it's combined with a lot of different binders and other things that we don't know what it is. So I always urge people that if you walk into, say, a bathroom or into a space where somebody has been smoking a lot of fentanyl, to exit. You don't need to stay in there. You don't know what else is in the air that's being burned, and you don't want to breathe all that in, but you're not really putting yourself at risk for overdose per se. The other thing that we get a lot of is that if you touch fentanyl, that you can overdose. Um, Fentanyl itself cannot easily be absorbed through the skin. So if you have lots of big open wounds, then you may be at greater risk for it going into your bloodstream through those open wounds. But just touching fentanyl itself will not, because it doesn't absorb through the skin in that manner, won't cause an overdose. One thing you do need to be aware of is that if a bunch of fentanyl gets into the air and you breathe it in, that can be dangerous. So if you are getting ready to, do CPR on somebody and they have a bunch of fentanyl powder on their clothes, you just have to be very careful that you're not shaking their clothes and moving it around where the fentanyl powder gets into the air and then you start breathing it in. So that is something to be aware of. But in the end, helping somebody who has been using fentanyl is safe. Cleanup. So if you are in a, business, it looks like a lot of you are at libraries and such. If you are in there and you come across a large amount of fentanyl, whether it's pills, powder, or some other form, just call 911 and they will take care of the large amounts. If you have small amounts, it may be very difficult to get 911, somebody from 911 to respond, but you can safely clean it up. We do recommend you use gloves, an N95 mask. You can put on eye protection. Don't use hand sanitizer. Use soap and water to clean anything up. You can use a HEPA vacuum. And I always suggest if you need to open up windows, air out the area, just so again that you aren't moving stuff around, the fentanyl around, and that you're unintentionally breathing it in, which can be dangerous. The other thing to keep in mind is when you think about kids, if kids come across, or this goes for anybody, but we see this more with children, is if there's fentanyl powder or substances around and children take it and get it on their fingers, they might not know it, and then they put those fingers in their mouth. So again, it's something to just be thinking about when you are around fentanyl. So real quickly, I wanted to talk about statistics for just a second. Um, we have seen nationwide a decrease in overdose deaths in the last 2 years, which is great. We saw a huge peak in 2022. I think that in 22, 110,000 people died from overdoses that year. And we've seen a decline since then. So that is fantastic. I was just on a call yesterday where they talked about how the decline has leveled off. So we're still seeing a large number of overdoses, and we're not seeing that decline anymore. And actually, the CDC saw an increase back in June, but that looked like it might have just been a blip. So again, there's still a lot of people that are overdosing, unfortunately. And those are fatal overdoses. Non-fatal is still very, very high. So you talk to people, and especially people who are around this, and they say the number of non-fatal are very high, but luckily with the access to Narcan, more people are being saved. And then 70% of all overdoses that occur in the US are fentanyl or fentanyl analogs. So very high number of our overdose deaths in the US are related to fentanyl. Um, and I'll just throw these few things out here also, because when we talk about fentanyl, sometimes there's people who think that it just affects one or two different groups in our communities, and that is not true. When you think about the number of children who've lost parents to a fentanyl overdose, it's staggering. This data is actually 2 years old at this point, but in the National Institute of Drug Abuse report said over 321,000 children lost parents. And, obviously that is a lot more in these last 2 years. It's a leading cause of death for 18 to 44-year-olds, and it's rising in deaths among 14 to 23-year-olds. So a lot more younger people are using fentanyl and dying from it. And then we have that fentanyl has become the most common substance in fatal poisonings for children 5 and under. And again, that goes back to children, finding something that looks like candy and then putting it in their mouths. So just a reminder, these aren't numbers. They are, our community members, our families, our everyone. In the foundation, we have numerous people who work with us who've lost family members, and we all know people within our community who've overdosed from fentanyl. So this is a very relative and important topic. And that is it for me. I'll stop sharing my screen. If we do offer the Narcan training, so you can contact our foundation, and we can help provide training to you.
And I'm going to put y'all's email address up on the screen here in a little bit. So
thank you.
before that though, let's do we got a few questions. So again, if you got questions, throw them in the Q&A box. Is there a risk of, you talked about this, but if you could go a little deeper, is there a risk of coming into contact with fentanyl when you're administering Narcan?
Potentially, yes. As I mentioned, if they have a bunch on their clothes or around their mouth, I would suggest wiping it off with something, because you don't want to be breathing that in. Again, it's very safe to administer Narcan, and if you're not going to be administering CPR, right? If you're not giving them mouth to mouth, you're safer. But just keep that in mind when you are rolling them over to the recovery position or whatever, that if they do have a lot of the substance on them, you do not want to get that airborne and breathe it in. But for the most part, it's very, very safe to help somebody who's overdosing and by administering that Narcan.
So there seems to be like news reports of law enforcement having overdoses from coming into contact with fentanyl, but that seems to contradict what you're saying. What's going on there?
Yeah, so I think there's several things that happen with that. I think law enforcement, it's not just law enforcement, we've seen this in other locations too, where they have come into contact and they have it on their hands, or they get it on their clothes, or it's in the air. So they maybe pull somebody out of a car, and the person has it on them and it gets in there into the air, and they breathe that in. But they sometimes, I think people have this fear too, right? And they have a physical response to, oh my gosh, I just had a fentanyl exposure, and some of that ends up manifesting itself in a physical way, but it's not an overdose. And I don't want to take away, because there are definitely cases where they've breathed it in. They're doing their job. They breathe it in, and they do end up having an effect. But just by, you know, talking to somebody who has been smoking pills, you aren't going to overdose.
What about fentanyl patches? Does that fit in here anywhere, or is that just on the non-illicit side?
They have found fentanyl patches or on blotter paper more than on the patches themselves. But we don't see a ton of that on the street. That is something I think that people who are using, who have access to pharmaceutical prescriptions, they'll get patches. But for the most part, we don't see that on the street very
Yeah,
often.
and I would assume we're not a huge risk of overdosing from a patch.
No, no.
All right, one final question, then we'll wrap it up for today. I've had staff share concerns about picking up litter around the building because they're fearful of coming in contact with fentanyl. Is that something they should be concerned and aware of?
So as I mentioned earlier, I would recommend, I tell everyone, it, you're always safer to put on gloves, you know, use a stick if you, or, one of those grabbers or something, so that you're not exposing yourself. It's not just the fentanyl, right? If you think about the way fentanyl is put into the illicit drug market, you don't know what else is in that substance. So it could be fentanyl, it can be a lot of other really bad things, and you just don't want to go and be touching that. If you don't have gloves, use a paper towel, use some other method to pick it up and safely dispose of it. You don't want to leave it out for a child or a dog, because dogs grab this, pets grab stuff, and they can overdose on fentanyl too, which I don't know if Nicole mentioned that, but Narcan is safe for your pets. So if your dog or something ingests fentanyl and they're overdosing, you can use Narcan on them, which is super helpful to know, because we all know dogs love to grab everything off the ground. So
I wouldn't have thought
okay.
about that, but that makes total sense. Yeah. Yeah, thank
Yeah.
you. Okay, so let's thank you so much. Anything else you want to throw in there before we wrap up today?
No, thanks again for having us.
Awesome, awesome. Okay, so like I said, I promised I would get you some information, y'all, about how to reach out to them. If you want to reach out to the Rayce Rudeen Foundation, that is their email address, info@raycerudeen.com. Also, you can just go to raycerudeen.com. If somebody on my team wouldn't mind throwing that into the chat box so that I can move on to the next slide, that would be lovely. info@raycerudeen.com. Thank you, everybody. Thank you to the Rayce Rudeen Foundation. This was fantastic. I thought I knew everything about naloxone. I learned a bunch, so super cool. And I'm sure like this is a special group that's here. It's not everybody on this planet that needs to know how to use Narcan. So you guys are in the kind of a special niche of people that have a job that really puts you in contact with the most vulnerable. So thank you for what you do. This is not easy work. This is not hard work. Take care of yourself. Care of your team members, and see you next time. Bye bye.